This is Caring for Kids on News Talk 760 WJR, presented by the Children's Hospital of Michigan Foundation. And here's your host, President and CEO of the Children's Hospital of Michigan Foundation, Larry Burns.
We've got a great show planned for you. Earlier this month, we had the opportunity, the privilege to participate in the Mackinac Policy Conference. And we had the opportunity also to chat with several key community leaders who are making an impact on children and our communities. So joining us tonight will be Dr. Antonie Garibaldi, President of the University of Detroit Mercy, Anya Babbitt, Founder and CEO of Split, Nolan Finley, Editorial Page Editor of the Detroit News, and Paul Hillegonds, CEO of the Michigan Health Endowment Fund. It's all coming up next on Caring for Kids, here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Well, welcome back, everybody. Larry Burns here at the fabulous Grand Hotel, and today, delighted to have our first guest on our show, Dr. Antonie Garibaldi, who is president of the University of Detroit Mercy. Dr. Garibaldi is the current president, and he's held this position since 2011. Prior to joining the University of Detroit Mercy, Dr. Garibaldi was the president of Gannon University. He has been nationally recognized for his more than 3 decades of teaching, scholarly work, and administrative experience in education and the federal government. He's involved in an awful lot of leading organizations in higher education, including the Association of Governing Boards Council of Presidents, which is probably the premier one that I'm familiar with, Association of Jesuit Colleges and Universities on the Executive Committee, Georgetown University, Horizon League Athletic Conference, which he chaired from 2013 to 2015. And Dr. Garibaldi, welcome to Caring for Kids.
Thank you so much, Larry. Happy to be here.
And appreciate it very much. The University of Detroit is an iconic name. University of Detroit Mercy is an iconic name in Detroit and beyond, and have many members of my family who are graduates, including my father, my brother, and other family members. So wanted to talk a little bit about as it relates to some of the things you do for children. And I know that the University School of Dentistry is located in Corktown and has long been committed to children's dental health. And tell our listeners a little bit about what you do for those kids in the community.
Well, one of the great things that our School of Dentistry and also our College of Health Professions, nursing, physician assistant programs do really work with children at their home sites, in many instances at the schools. So our School of Dentistry, for example, is a community-based dental education program. Right. So we make sure that our students really get out. We do that in 2 ways. One is through mobile clinics that we will take directly to the schools. And then some of them are at the clinics right at the university. And then there are about 12 other sites around the states. We focus in large measure on individuals who do not have much health care in their particular areas. So these in the professional field are really called health professional shortage areas.
Okay.
So our students, through their 4-year dental program, for example, they get exposure to lots of different individuals. They can be immigrants, they can be refugees, or individuals who are from low-income families. They're elderly patients, in many instances, people who don't have the resources
or the transportation,
or the transportation to get good, solid oral health care. So by taking the mobile clinics, for example, to the schools, we have a program called Titans for Teeth Mobile Clinic.
All right, I like it.
And the students know, the young people at the schools, they know that these are the people who are going to come and also going to assess their oral health care and the kinds of ways in which they will be able to take care of it. Very much the same way in our School of Nursing and the Physician Assistant Program. Both of these programs really take the students to those particular sites. So every semester, for example, at least 90 of our nursing students are usually going down to Children's Hospital of Michigan.
Right.
They are working with pediatric patients primarily to provide them with all the basic information they need about taking proper care of themselves. So that's a required course for our nursing major. So they are involved every semester of their schooling in one of these particular sites.
Awesome. We're talking with Dr. Antoine Garibaldi from the University of Detroit Mercy, and talking about some of the services that the university, the students, and the faculty provide that most people might not be aware of. And one of the things that I've learned in my experience in higher ed is that having students involved in a community that is underserved provides such a different way to educate them. They not only see things that they might not see if they weren't in that environment, but they also learn as they become, in this case, dentists or nurses, the environmental issues that impact people, and it impacts their health care. And so I think it's a great way to provide great technical but also environmental education for these students.
Well, that's right. And physicians will tell you that oral health care or oral health diseases are probably the best indicator of future illnesses and significant diseases. So taking care of the mouth becomes extremely important. And we have lots of instances where young people who receive some of this care probably needed all of their teeth replaced in some instances. So children are afraid, for example, of even going to the dentist. You know, the mere thought, as we did when we were growing up, is like, oh no, please don't.
A cavity.
But they can actually go to a dentist these days and have an enjoyable experience. And that's more and more what we find by these students. The same way our nursing program, and I say the nursing, but also physician assistant program and other ways in which they provide help. You know, we have the Macaulay Center on the east side, where individuals from the community receive health care. Students also receive health screenings at Henry Ford Hospital. So there are some partnerships that we've developed just to try to make sure that the students get exposed to a health professional and can actually be able to articulate what some of their problems are and what their concerns are as well, health-wise.
Well, and we've talked on this show recently that the Children's Hospital of Michigan Foundation has its first real priorities, and wellness is one of those, so this sort of fits into that, and also mental health. And your background in teaching and educational psychology, and what is your experience with how learning and health go hand in hand for these kids? And so I'd be interested to see your point of view on that.
Well, sure. I taught 5th and 6th grade early on out of college, and worked with students in high school as well. First and foremost is a student's not going to do well in school if the children have not been properly fed, or if they're hungry. All of that affects how their brain operates, their ability to be able to retain information, their whole eagerness to learn. So making sure that a student is taken good care of health-wise is very important. So many children, for example, today have significant problems with their eyes.
Absolutely.
And so many times, if a student does not get the kind of proper health screening, parents don't know that their child can't read the material, let alone verbalize what the words really are. So health and education go hand in hand, and you can't have one without the other.
And so I know in the future that we can have some great partnerships with our foundation and your university and the programs that we're talking about now and other things. And as we sort of expand our view of how we can impact kids, partnerships with University of Detroit Mercy will be one of those, that I'm sure of. So look forward to it. And so I have to ask you, how are things in the Titan Nation in general?
Things are very, very well. We're looking forward to another great season in basketball.
Great.
Last year under Coach Bakari Alexander, it was a little difficult time, but that was his first year. I think he's got some great recruits coming in, and really all of our other 18 Division I athletic programs are doing exceptionally well. And I always say the best part about it is that our students have a grade point average of more than 3.0 across those 300 plus student athletes, and they're graduating from college.
That's what it's all about.
Why they're there in the first place.
Absolutely. And so one last question. I recently moved back to Detroit after being gone for 27 years. in Ohio, and it's great to be back. It's such an important time in Detroit's sort of movement, and how is that impacting your university?
Well, it's impacted in a very, very positive way. We have fortunately been working on revitalization of the neighborhood, Livernois, McNichols, for the last six years. So it's really exciting when you hear residents talking about a lot of the exciting things that are going on. We're hoping to bring in new businesses, also new residents into the area, working very, very hard at continuing to increase safety and working hard on really neighborhood stabilization. That's first and foremost. So we're looking forward to the Fitzgerald Neighborhood Project taking off, and our Lift 6 Alliance will have a temporary office on Livernois and a permanent office on McNichols within a matter of 6 months.
Okay, great. Well, stay tuned. We'll have you back on if you're willing to talk more about the great things at the University of Detroit Mercy. And I want to thank Dr. Antonie Garibaldi, who is president of our University of Detroit Mercy. Thank you, sir, very much.
Thank you, Larry.
Appreciate it very much.
Appreciate it.
Coming up next, we'll hear from Anya Babbitt, founder and CEO of Split, who is making an impact for Detroiters with assistance, those people in need of medical transportation. When Caring for Kids continues, here on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Hospital of Michigan Foundation. Once again, here's Larry Burns.
Back on the beautiful island, Mackinac Island that is, the Grand Hotel, looking all these leaders, politically, business leaders, and we have an entrepreneurial leader to interview next, Anya Babbitt. She's the founder and CEO of SPLT, known as Split. Got that right?
You did.
Thank you. And as a marketing entrepreneur, Anya has successfully provided marketing strategies and services to several notable institutions and luxury brands. In addition to Split, she has launched a string of companies, including a luxury marketing and events company, a short-term apartment rental service in New York City, which has got to be interesting in itself, and a real estate consultancy. So, Anya, welcome to Caring for Kids.
Thank you, Larry, for having me.
Appreciate it. And busy time up here. I hope your conference is going well.
It's going very well. First time on the island.
Oh, it is? What do you think?
It's great. It's taking me back to days of the 1800s.
Right, yeah, with the horses and the beautiful view. The weather could be a little nicer, but...
It took us coming to Mackinac to see all these familiar faces from Detroit.
Yes, yeah, exactly. So the vision of Split, SPLT, we're going to say Split, is to, and I'm quoting, change the way people meet and move worldwide by providing reliable, affordable mobility access for all. And how does Split accomplish that, and how did you come up with the idea?
The origin story for Split occurred 3 years ago when I was living and working in Los Angeles, one of the most congested cities in our nation. And I was working out of a hotel and needed to get downtown for a meeting every morning. And the hotel shuttle bus was overbooked. And so fortunately for me, I found a ride with two other guests staying in the hotel and decided that there needed to be a way to commercialize that naturally occurring ride-sharing concept.
Right.
So it took me going back to New York and seeing how there were other initiatives in the city from the Taxi and Limousine Commission where signs were promoting people to share rides from uptown all the way down to the financial district. And advisors encouraged me to form an application that would allow for people to come together and share their commute. But it really wasn't until we moved our business to Detroit 2 years ago and took part in Techstars Mobility did we really realize that vision on a larger scale, where instead of addressing consumers, we could address organizations, universities, and municipalities to align rides for employees, residents, and university students.
Great.
So that's what brought us to Michigan.
Yeah, and I want to talk a little bit more about that.
Sure.
And then about the business, too. And so you mentioned you were in L.A., you mentioned you lived in New York, right? And now your business is in Detroit.
It is.
So what, and I'm glad for that, but what brought you to Detroit over these other bigger cities?
It was really Techstars Mobility that brought us to Detroit, and it was after having mentors like Bill Ford and all of the other
great mentor,
all the other organizations that participated as marquee sponsors in the event, the mayor's office, the governor's office, as well as leading investors in the region, did we realize that we had formed a community, one that was very collaborative, energetic in scope, and allowed us to make a real impact in a city that needed us more than New York City.
Right. So we're talking with Anya Babbitt, founder and CEO of Split. And so how do you like Detroit? Let me ask you that.
We love it. It's energizing. It's gritty. We're surrounded by people who have come there for reasons similar to us.
Right.
And there's lots of change happening,
Awful
which
lot
we're
of change.
a part of. And there's access to the community, access to the mayor's office, and everyone just
Yeah.
wants to see you win, because if you win, then Detroit wins.
Yeah, and so that's great. So let's talk a little bit about healthcare. I was talking yesterday on the island with Lou Ann Ewald, the CEO of Children's Hospital, about I mentioned that I'm going to have an opportunity to interview you, and we were talking about sort of one of the number one reasons that kids don't get the health care they need is because they don't show up for appointments. They don't have transportation. And can you tell us a little bit of how Split tries to deal with that?
The CEO of Next Energy, an organization that really supports startups, had an idea for our company about a year ago. That was Jean Redfield. And she said,
Okay.
if there was a way that you could augment your technology and provide non-emergency medical transportation to the ill, the disabled, the elderly, and children, then that is a service we especially need in Detroit. And so it wasn't until our company was brought to Google Demo Day in Mountain View as the one company to represent Michigan, were we able to realize that dream and have an in-person meeting with Lyft,
Okay.
who decided to form an exclusive partnership with us, where we are co-building a healthcare initiative to do just that, to provide non-emergency medical transportation and to combat the 4.5 million missed appointments.
Wow. And so what hospitals or organizations are you currently working with?
We have support in the region. Beaumont was one of the first hospitals that
Good,
really took an
good,
interest,
good.
and their fully owned subsidiary Peristar, which provides ambulatory services. So it's not just Lyft that we partner with, but we also partner with other transportation providers to accommodate for different vehicle types and requirements that people need. So a lot of new initiatives. We're about to sign a deal with an organization that has
Okay.
many
You're not gonna
hospitals in
tell
the
me,
region.
right?
So stay tuned.
Good. We will. And we'll announce that on the show and on WJR. And where do you see the business going beyond some of the growth you mentioned?
We're really committed to the healthcare space and growing that out more, as well as education, as
Okay.
well as children. I think those are core themes in Detroit, and that level of social impact and stewardship is very important to my co-founder, Il Zhang, and myself. He comes from a background in healthcare initiatives and providing different wearable devices for people to track their own healthcare progress. So with IoT, as well as working with the healthcare initiatives, to really combat what you had said, that the biggest barrier to treatment is transportation.
Transportation.
Yes.
And, kids can't get themselves there, and,
Right.
and many times their parents don't have the ability, and it's just a vicious cycle. And so what you're doing, I think, is not only innovative but needed, but can really help solve some problems. And I'd love to keep in touch and find out ways that maybe our foundation and Split and your organization can do some things together to help the kids of our community.
That would be great. We love partnerships.
So, well, welcome to Detroit, welcome to Michigan, welcome to Mackinac, and I look forward to staying in tune and hearing about your announcement.
Thank you, Larry.
Great. Thank you very much. Anya and Babbitt, founder and CEO of Split, and we'll be back with more guests from Mackinac Island. Next, we'll speak with Detroit native Nolan Finley, the editorial page editor of the Detroit News, when we return on Caring for Kids on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Hospital of Michigan Foundation. Once again, here's Larry Burns.
We are delighted to have, for the very first time on our show, Nolan Finley, who is the editorial page editor from the Detroit News. Nolan he joined the new Detroit News staff as a copy boy in 1976. Which is a long time ago.
It is.
It is. Over the years, Nolan has shared his award-winning passion and mentored hundreds of reporters who passed through or stayed at the Detroit News. And he was inducted into the Michigan Journalism Hall of Fame in 2012. And he is an important voice in our community, and his voice is now on Caring for Kids.
Good to be with you, Larry. Thank you.
Thank you. I know this is a busy time for you up here on Mackinac.
It's a good time.
It is a good time. And one of the things as an editorial page editor, of the Detroit News. You have the opportunity to put healthcare and wellness, in this case of children, at the center of your advocacy efforts, and you have a lot of other things you can do, and you do well. But is this a priority of yours, this wellness and for kids?
Well, yes, all of that, including education, which I think in terms of a child's well-being, getting a child a good solid education and preparation for life is extremely important for their long-term well-being and mental health and success in life. I think it starts there, but also you have to look at nurturing children and seeing, you can't send them to school unprepared to learn, and so a lot of that goes into making sure they have the health care and the nourishment and to go and be prepared to learn.
Right, and I mentioned earlier that the foundation, the Children's Hospital Michigan Foundation, we have our first ever priorities in wellness and nutrition, mental health are two of those. And one of the things that you mentioned about education, I spent 27 years in higher ed, and I believe you can impact more lives by getting children on a pathway to education than you can with disease.
Oh, yeah.
And so we're expanding our view of how we can help kids into education and wellness. And
it goes, right up to educating their parents. Detroit is one of the most dangerous places in the world for children, for young children, teenagers. And it's not just the violence, although violence is a part of it. We have among the highest premature births in the nation and prenatal lack of prenatal care, very spotty amongst city residents. Infant mortality is very high. We've got to start getting to children even before they're born in the womb, and making sure their mothers are healthy and that they're healthy through those first few years of life. And the Detroit News did a series of articles on this, Karen Buffard, a year or two ago, on the dangers to kids in this city from, as I said, not just violence, but from lack of health care. It's not necessarily poor health care, it's just they're not pursuing it. I mean, they're not getting it, and so they're not getting their immunizations, they're not getting that early child health care and treatment, and these are things you can fix.
Absolutely. And we, at the foundation, we can't fix everything, but I think we can play a catalytic role in helping these things, and that certainly is our role. And with all the positive things going on in Detroit, and I mentioned earlier that I moved back after 27 years being away. Yeah. And delighted to be back home where I grew up. And what are your thoughts about the city with the positive things and the things that we're talking about? What do you think of the future?
As you mentioned, 41 years I've been there, and this is the most hopeful time I've ever seen, and the first sustained recovery I've ever seen. There's been fits and starts over the years. People had great ideas that we're going to fix Detroit this way or that way. But this has really taken off, and it's strong, and it's ongoing, and it's been going long enough and strong enough that you have to believe it's real. And this is the first time I have been very optimistic about the city's future. I think we're getting at some of the problems that have nagged us, and we're making the investments we need to make, and I'm very hopeful that we can keep it up.
Good. We're talking with Nolan Finley, the editorial page editor of the Detroit News, and we're up here at Mackinac at the 2017 Policy Conference. And what is your sense of the feeling up here about cooperation and about people working together?
I think we're seeing the business community working very closely together, first time in a long time. You're seeing the state legislature working more closely with Mayor Duggan to try and get some good policies through to help folks in the city with things like auto insurance and what have you. I think it's a very cooperative environment, and everybody seems in the same place in terms of wanting Detroit to succeed. That hasn't always been the case.
Right. And so Children's Hospital Michigan Foundation, I mentioned that we're kind of expanding our view of how we can help kids. And I'm new in my job. I started in January.
Yeah, well, welcome.
Thank you. And because of your role and the voice that you have, along with others at the News, I mean, do you have any advice to the foundation of how we can engage with the community and how we can be relevant moving forward to making it better for kids in Detroit and southeastern Michigan?
All I would say is the first step always in Detroit is building trust. You can offer programs and open your doors, but getting people to walk through them isn't always as easy as it should be.
Right.
And I think a lot of organizations don't understand that. And, you know, they say, wow, we're offering this great thing and it's free this or free that, and nobody's taking advantage of it. Well, you've got to start with relationship building in the community, building trust, and showing people you're sincere and that you're here for the long run.
Gotcha. Well, we certainly, the foundation is, the hospital has been the long run. The foundation will be in it for the long run, and so that's great advice. Is there anything else that you want people to know about the editorial efforts of the news or the news in general?
You know, we're here to scold those who need scolding and praise those who deserve praise, and
right.
you know, we'll continue to do that. And you know, we think there's a lot of potential in Detroit,
right.
as long as it stays on track.
Okay, well, we'll keep you updated on what we're doing. And one of my favorite things each and every morning is to read the Detroit News.
I appreciate it.
Thank you very much.
Keep reading, Larry.
Special thanks to Nolan Finley, editorial page editor of the Detroit News. Next, we're going to talk with CEO of the Michigan Health Endowment Fund, Paul Hillegonds, when our show, Caring for Kids, continues, right here on the great voice of the Great Lakes, News Talk 760 WJR.
Caring for Kids.
One of the leaders that I was able to find and convince to be on our Caring for Kids show is Paul Hillegonds, who is the CEO of Michigan Health Endowment Fund. Paul, welcome.
Thank you, Larry. It's good to be here.
Appreciate it. I know you're really busy up here, and take a few minutes to talk about Michigan Health Endowment Fund. But first, I want to tell our listeners a little bit about you. Paul is the Chief Executive Officer, as I said, of the Michigan Health Endowment Fund. In March of 2014, he retired from DTE Energy as Senior Vice President of Corporate Affairs. He was a member of the Michigan House of Representatives from 1979 to 1996. Very impressive. Where he had held several leadership posts, including Speaker of the House. Very impressive. Paul is Chairman of the Board of the Directors for the Regional Transit Authority of Southeastern Michigan, and he also serves on a number of boards, including the Children's Leadership Council of Michigan, the Citizens Research Council, the Grand Valley State University Foundation, New Detroit, the Center for Michigan, and the Michigan chapter of the Nature Conservancy. Paul, wow, that's a lot of stuff.
All important.
It's all important.
It's a pleasure to serve.
Well, it's a pleasure to have you part of all of this and to be on our show. And I first want to start by saying thank you on behalf of kids and our foundation and our board to the Michigan Health Endowment Fund for your support. In 2016, you approved a grant of $80,000 to support what we call the Safe Baby Academy, Protecting Your Sleeping Baby program, which started just this year. So thank you.
You're welcome. And thank you for what you're doing in the community. Infant mortality is a concern in the
really
city
is.
and in the region. And what you're doing to deal with infant death syndrome by educating parents on sleep practices is very important.
Yeah, and we were talking to Nolan Finley earlier, and he brought that up as part of one of the issues that our city faces. So working together, we can do a lot of good. And so I appreciate your support. And one of the things that I wanted you to spend a couple minutes on, if you don't mind, is to the listeners who are not all that familiar with the Michigan Health Endowment Fund and the mission of the organization.
Yes, the Health Endowment Fund was created by state law in 2013 when Blue Cross Blue Shield was reorganized into a nonprofit mutual. And as part of that legislation, they made a commitment to fund the Health Endowment Fund over an 18-year period.
Okay.
Our mission is health and wellness focused on children and older adults in Michigan. We're state-based. And we are really working on also reducing health care costs by preventative care, identifying issues early on in a child's life, screening behaviors or screening early signs of chronic illness that allow you to intervene early and avoid going into a hospital in the first place.
Right. And I mentioned earlier in the show, and almost every show, that the Children's Hospital Michigan Foundation now has 5 priorities. Not that we won't look at other things and fund other things, but many of those priorities are preventative, keeping kids out of the hospital. And so, when I started my job and met Terry Gardner and then had an opportunity to meet you and your colleagues, that I think the similarities in what we're trying to do for kids in this regard can lead to some strong partnerships.
Exactly.
And so recently the Michigan Health Endowment Fund, and we're talking with Paul Hillegonds, who is the CEO of this organization, announced $8 million in grant funding to improve health for children and seniors. And so can you talk a little bit about some of the key things within that $8 million?
Yes, we are operating under a strategic plan adopted by our board, and we focus on children, especially in the area of nutrition and healthy living.
Okay.
And so those grants did really address those issues. We have a 15% food insecurity rate in the state of Michigan, which is higher than most states, which means that we don't have adequate access to healthy food and its preparation in too many cases. So early intervention, making available healthy food to children, working with parents on preparing healthy food, we think will deal with what are too high obesity rates in the state and the connected chronic illnesses like heart disease and diabetes which show up.
That show up and end up in the hospital and a pathway to an unhealthy life as an adult.
So examples of the $8 million. One that I really enjoy talking about in Alpena, the Senior Citizens Council is working with the schools in the school cafeteria, teaching students to prepare healthy food. And in turn, those students prepare healthy food that's delivered for Meals on Wheels.
For adults.
For
seniors.
It's an intergenerational program and a great example of how we can fulfill our mission. The whole issue of schools and wellness in schools is being addressed by a grant we've made to the Michigan Elementary and Middle School Principals Association. They've targeted over a dozen schools to work on integrating wellness programs, good food programs into their school improvement plans. In these kinds of grants, we're also doing evaluation. We want to measure whether the outcomes are successful, and we hope that if we can show success, that we can help inform public policy and practices in the state.
Absolutely. And of these 5 priorities that we have, wellness, nutrition is the one where we have the least amount of experience, but we've identified the need like you have, and so hopefully we can learn from each other on how we can take our... Last year we gave out $6.6 million, which is a lot of money, but if we can partner with organizations, maybe we can have 1 + 1 = 3.
Exactly.
And so in particular, this area of wellness and nutrition, we need some partners to teach us, how we can best spend our grant money.
One of our goals as a health fund is to encourage partnerships, not only with other funders, but with organizations in the community who can work together, who have cross purposes sometimes, and don't work together. And we have limited resources. We need to leverage more partnerships and the sustainability that comes with that.
Yeah, exactly. And so one of the other priorities we have is mental wellness, mental health, and I know that behavioral health and mental wellness is also a focus of the Michigan Health Endowment Fund, and can you tell us a little bit about that?
Yes. Behavioral health for us means mental health programs with an emphasis on integrating primary care and mental health services so that the service providers aren't operating in silos, and that can happen in schools, it can happen in the primary care places. We also are doing early intervention again. 20%, over 20% of our children in Michigan live in poverty today.
Right.
And in the last 10 years, there's been a 30% increase in reported abuse and child neglect. There's a lot of stress-related experiences that occur in children's lives today due to economics, due to family structure perhaps, violence in neighborhoods. And we need to identify those traumatic events, screen early, and then intervene in children's lives. That can save tremendous amounts of dollars and services down the road in mental health and even in incarceration rates.
Absolutely. And I often say that children with mental health issues many times grow up to be adults with mental health issues, and so that intervention, that finding out early, just talk to teachers, and particularly in areas of lower income, they just have some of the most heart-pulling stories of these poor kids, and so what you're doing is something we want to help with as well, and it's all integrated. So much of it is integrated with one another, from nutrition to mental health.
Well, and we do find that there is this connection between chronic illness and mental health. Depression can lead to physical illness. Physical illness can lead to depression. We need to focus on the person, not on the services, and integrate around the person.
You're so right. Is there anything else you want our listeners to know about the endowment fund?
Well, we are currently engaged under the law. We have a 5-year program where we are making available $120 million in subsidies of supplemental Medicare, Medigap coverage for older adults. And that program is ongoing. We want people to know about it. It's those who are at a poverty income level of 225% or below, or about $26,500 for an individual, $36,000 for a couple, household income, could qualify. And if there's interest in that, it helps make supplemental Medicare more affordable. We hope they'll check out the MichiganMedigapSubsidy.com website.
Okay, all right. We'll put that on our website as well, and we'll get that message out. So I want to thank you for being on the show, and even more importantly, thank you for what you and your colleagues are doing.
Thank you, Larry.
Thank
you for what you're doing.
Oh, thanks. And we're going to do more together.
You bet.
That is my hope. That's Paul Hillegonds, who is the CEO of the Michigan Health Endowment Fund. Thank you for joining us on Caring for Kids. I'm your host, Larry Burns, President and CEO of the Children's Hospital of Michigan Foundation. We're delighted and proud to present this show, and for more information on Caring for Kids, you can visit us at www.chmfoundation.org/caring for kids, and follow us on Twitter and Facebook at CFK Radio Show. CFK Radio Show. And most importantly, join us again next time at 7 p.m. on Tuesday, July 25th, for more discussion about the health and wellness of children on Caring for Kids. Right here on the great voice of the Great Lakes, News Talk 760 WJR.
Caring for Kids on WJR has been presented by the Children's Hospital of Michigan Foundation.